Good morning. This is Dr. Suhas Haldipurkar. I'm an ophthalmologist practicing in Panvel. Very often, patients are scared about the surgery. Today, cataract surgery has reached a stage where it is stitchless, bladeless, and patchless surgery. That means you just put a drop in the eye before operating. So it becomes absolutely a painless surgery. The normal way in which a patient is prepared is that before he is given a date, he undergoes some basic test and then gets a physician's fitness. On the day of surgery, some drops are put to dilate his pupil, and then he's taken up for surgery. After the surgery normally takes around 10 minutes, and after the surgery, he rests for half an hour and then he goes home. Normally, the post-op is a very routine one. From the next day, like if he's operated today, from tomorrow, he can practically resume all his activities. He just has to wear some protecting glasses for a week or so, but he can resume most of his activities. Next day, in fact, a patient, if he wants to drive, he can drive. He can sit on the computer. He can go to the kitchen. So that is the level of perfection that has come into cataract surgery today. Patients ask us, doctor, will there be a lot of pain? No, it's practically a painless surgery. After the surgery, the patient is required to put drops depending on the regime that we use, either for 10 days, 20 days, or a month. And after 2 weeks, we give glasses, depending on what kind of lens we have put. So in conclusion, I would like to say that today the cataract surgery has really advanced. And if you have any of these symptoms, if you have difficulty driving, if you have difficulty in seeing things clear, it's always better to go for an eye checkup to the nearest ophthalmologist that you have. Because when you visit an ophthalmologist, he'll have a look at your lens, he'll look at your retina, and there'll be so many other diseases which can be picked up when you go for a checkup, because there are many diseases which will not have any symptoms and they can only be seen when you go for an examination. For example, glaucoma is one disease which you normally get after you become adults. But that glaucoma will not have any symptoms till very late. So it's always a good idea to go for a regular checkup. And even after the cataract surgery is done, it's very much necessary that you go for a yearly checkup to the doctor that has operated or to the nearest doctor, because the lens that is put inside the eye needs to be observed, examined, and checked on a regular follow-ups.